Diabetic ketoacidosis, DKA, is a very dangerous disease that can cause a diabetic coma or even death. In order to stay safe, you need to know the danger signs. DKA happens when your blood has too many ketones. This happens when your body doesn't have enough insulin and burns fat for energy instead of glucose. This process makes your blood acidic, which is a sign that you may not be taking care of your diabetes well or that you are sick. High amounts of ketones are dangerous and can cause DKA. People with type 2 diabetes are less likely to get this condition, but anyone with diabetes can get it. Hospitalization is often needed for treatment, but knowing and recognizing the early signs can stop it from getting worse. It is very important to check your blood and pee for ketone levels on a regular basis. The video talks about 7 deadly signs of diabetic ketoacidosis that most diabetics don't pay attention to. Number 7. Too much urination and thirst. An insatiable thirst and the need to go to the bathroom a lot are early signs of DKA. This happens because your body is trying to get rid of extra sugar by peeing, which makes you thirsty. Number 6. High blood sugar. Having blood sugar levels that stay high for a long time is a sign of DKA. When you don't have enough insulin, your body can't use glucose for energy. This causes your blood sugar to rise, which can cause major problems. Number 5. Feeling sick and throwing up. As your ketone levels rise, you may feel sick and throw up. This is how the body reacts when it is in ketosis, and if it isn't fixed, it can quickly make you thirsty. Number 4. Fatigue and weakness. Even though your blood sugar is high, your cells aren't getting the energy they need, which makes you feel tired and weak. This lack of energy is one of the most important signs of DKA. Number 3. Lack of breath. When ketones build up in the blood, it can cause ketoacidosis, which makes the blood more acidic. This acidity can make you breathe quickly or have trouble breathing, which is a sign that you should never ignore. Number 2. Fruity breath. One of the most obvious signs of DKA is breath that smells like fruit. This happens when the body tries to get rid of extra ketones by breathing. Number 1. Trouble or confusion. Focusing. Having a lot of ketones in your blood can change the way your brain works, making you confused, unable to focus, or even passing out. This is a very bad sign that someone needs medical help right away. If you want to know pre-diabetic signs, however, you save others to reach the DKA situation. The link of our video is in the description box. What causes diabetic ketoacidosis? An inability to make enough insulin is the main cause of diabetic ketoacidosis, DKA. If you don't have enough insulin, sugar can't get into your cells to be used as energy. This makes your blood glucose levels rise. Because of this, your body starts to use fat as fuel, which makes ketones. Ketones can be harmful if they build up. High blood sugar can also make you urinate a lot, which can make you lose water. There are many things that can lead to DKA, like not taking insulin as recommended, not eating well, or being stressed. You can also get DKA from getting sick, like with asthma or a urinary tract infection. If you have a fever, cough, or sore throat, which are all signs of an infection, you need to see your doctor right away. DKA might be the first sign that you have diabetes in some people. Can diabetic ketoacidosis be avoided or stopped? You can keep an eye out for diabetic ketoacidosis if you have diabetes. Pay close attention to your blood sugar when you're sick, so it doesn't get too high or too low. When glucose levels are more than 250 mSdL, patients should keep a close eye on them. When you're sick or worried, you should check your blood sugar more often, every 3 to 4 hours at times. When your blood sugar gets too high, check it every hour or two. Talk to your doctor about checking your blood sugar at night. Also, check your urine for ketones every 2 hours if you're sick, worried, or have blood sugar that is higher than 200 mg/dL. How to treat diabetic ketoacidosis. DKA makes people urinate a lot. You will have to go to the bathroom more often than usual. That's because your body can lose electrolytes, which are minerals in your blood that help it work. The most likely way for your doctor to treat DKA is to give you fluids, generally through an IV. Electrolytes and insulin will be in these fluids. Having electrolytes in your body will help it work properly. Insulin can help bring down your blood sugar. In general, drinking water can help you feel better and lower the amount of sugar in your blood. If you want to learn how sugar defenders help with DKA symptoms, then go to the description and watch the video. And you can easily buy this product from the link in the description. Diabetic ketoacidosis, DKA, is a dangerous disease whose fatal signs you should be aware of. It can save lives to be aware of signs like increased thirst and urination, high blood sugar, nausea, tiredness, shortness of breath, fruity breath, and confusion. DKA happens when the body doesn't have enough insulin, which makes it use fat for energy and make dangerous ketones. Keeping an eye on your blood sugar, especially when you're sick or stressed, and checking for ketones on a daily basis can help you avoid DKA. To treat DKA, it's important to stay hydrated and get medical help. By knowing these signs and taking proactive steps, you can greatly lower the risk of major complications. Don't forget to share, write, and subscribe to stay up to date and help others do the same.